These medical students said they had no idea the hospital where they worked would undergo a huge reorganization, mostly because it won't affect them. The move by Baylor Scott White to cut 1,700 jobs system-wide will mostly come from overhead at a time when the hospital business has become tougher than ever. Experts say hospitals covered the cost of more people who couldn't pay due to the COVID pandemic, while states prevented them from pursuing better-paying patients.
Revenues from things like elective surgeries, which are normally a profit center for hospitals, and things of that nature were largely on hold and down dramatically, which really put a squeeze on revenues.
It caused a huge loss of healthcare jobs across Texas, but Baylor Scott White, with a strong balance sheet, will bet against that trend by shifting more resources to healthcare. Baylor Scott White makes up the biggest nonprofit healthcare system in Texas, with 52 hospitals, more than 800 patient care sites, and over 47,000 employees, including doctors on payroll and its many joint ventures. Hospital leaders say that this reorganization takes resources away from overhead and administration and adds it to where it matters most, to patient care. In a statement, the company says the job losses come almost exclusively from accounting and billing. These back office functions, it says, while important to our operations, can often be provided at a lower cost if we partner with best-in-class providers, with the goal of increasing our focus on patient care. So what's the impact in Central Texas? Temple Mayor Tim Davis says the local job losses amount to less than 200.
2/3 of them are going over to the vendor that Scott & White has hired to take over their duties.
The other 60, he says, can retrain for patient-oriented jobs, especially important since the company plans to open a branch campus of the Baylor Medical School here.
I was assured by the president of Scott & White yesterday that that Scott & White will continue to pay these employees salaries, until they've either been retrained or move on to another organization.
Something almost unheard of these days. As for the company's refocus, experts say it's hard to argue with the company taking from overhead and putting it toward its core business, helping guarantee jobs for these medical students in the years to come. In Temple, Dennis Turner, 25 News.